Hello everybody, my name is Greg Barrick, and in this video we'll be discussing the pelvis, but a little bit more specifically, the pelvic floor, and we'll also get into a little bit of pelvic tilt, in particular, anterior pelvic tilt. So some of the anatomy and function involved in the pelvis. First and foremost, you have the pelvic floor. It's comprised of levator ani muscles that help elevate organs such as the bladder, uterus, rectum, and vagina. So, inherently, it plays a role in the reproductive system. Levator ani muscles consist of pubococcygeus, puborectalis, iliococcygeus,
Pubococcygeus muscle. Iliococcygeus muscle. Coccygeus muscle.
Some of the fascia tissue involved in the pelvis is the pelvic fascia, which is a layer of connective tissue lining the superior and interior aspects of the diaphragm. Now, on the bottom of the diaphragm, we have what's known as the pelvic floor. This fascia tissue also helps provide support for the connecting structures. Some movement flaws involved in the pelvis region consists mainly of pelvic tilt. And with pelvic tilt, you kind of have several facets involved: anterior pelvic tilt, posterior pelvic tilt, or lateral pelvic tilt. Moreover, you also have pelvic rotation and pelvic torsion, created by muscle imbalance, posture, and prolonged sitting. Some common injuries associated with this area are avulsion fractures, which is typically when a muscle or tendon pulls bone away from the pelvis. Additionally, you also have acetabular fractures, and this is predominantly occurring in or around the hip socket. Some ways that we can kind of improve the health, longevity of our pelvis region is an exercise commonly known as the bridge pose. One of the best exercises that you can do to kind of give your pelvis a little bit more longevity and make sure that it remains healthy is the bridge pose. And I'm gonna put my client Anthony through that pose now. So the first thing I'm gonna do is have Anthony lay supine or flat on the floor. So Anthony, please lay flat on the floor with your shoulder blades flat against the floor. Just relax your shoulders, please. The next thing that we're gonna have Anthony do is bend his knees 90 degrees. Pull those knees back a little bit more, closer to your glutes. Pull them all the way back. That's good. You don't have to scoot back anymore. Now, Anthony, I'm just going to feel for your anterior superior iliac spine, which is going to be right around here. Have you been experiencing any lower back pain? Great. I'm going to have you lift your pelvis up right across this plane, this transverse plane, a little bit higher. That's excellent. So we want the shoulders, the pelvis, and the knees in a straight plane. That's really good. Lower slowly. And then come up one more time. Right there is great. And then lower again. And this is an excellent exercise to facilitate health in your pelvic region. Thank you. When checking for pelvic tilt, you want to build a little bit of a rapport with the person that you're working with, right? Ask them if they're experiencing lower back pain, more specifically in the lumbar spine. You can check them for anterior pelvic tilt, and we'll get into that a little bit more. Anterior pelvic tilt is commonly understood as the front of the pelvis pointing downward, and sometimes this is often attributed to tight hip flexors, right? But there are some areas that we can also check to see how the body is aligned, and that begins with the anterior superior iliac spine. So we want to be able to define or identify rather the anterior superior iliac spine on our client, and we just kind of want to feel, is there any misalignment? Is there any deviation from one side to the other? We're also paying attention to posture. Is there excessive lumbar curvature in the low back? Is the belly jutting forward? Oftentimes when we see people with the stomach or belly jutting forward, it tends to create or attribute to anterior pelvic tilt. Another area that we can look into when trying to diagnose pelvic tilt is the posterior superior iliac spine. This particularly bony structure is located on the iliac crest.
Hello, my name is Greg Barrick, and in this video, I will be performing a floor test to evaluate myself for any potential anterior pelvic tilt. I'm going to begin this test by keeping my knees at 90 degrees, my feet flat on the floor, and I'm going to lay back so my back is flat on the bench and parallel with the floor. Now with my feet flat on the floor and my back flat to the bench, I'm going to take my hands and see if I have any difficulty slipping them beneath the lumbar spine or under the small of my back. I can do this pretty effortlessly as there's a noticeable gap. I'm now going to attempt to smash my lumbar spine down to this bench and just flatten it out. I'm going to do this by tightening the abdominals and the glutes. Although I was able to diminish the gap between my lumbar spine and this bench and flatten out pretty well, it was difficult. Not only was it difficult, my feet also wanted to rise off the floor. This could potentially be an indication of anterior pelvic tilt. Now, there are other factors at hand here. I could be suffering from extremely tight hip flexors, and that's just something else you want to be mindful of when performing this test.